Insufficient milk supply and hypoglycemic baby. After assessing the infant and ensuring that airway, breathing, and circulation are adequate, and after providing the infant with appropriate medical intervention, i.e. having the baby assessed by the doctor or an IV drip, the three best practice measures to begin to solve this problem are: 1. Frequent feeding. If the infant is unable to feed, encourage the mother to express milk frequently to maintain and establish a supply. 2. Proper latch-on, which will aid the infant in feeding and will allow the mother to develop a supply. 3. Monitor infant's blood glucose and weight to determine if the baby is getting an adequate amount of milk. This is important because if the infant is not getting enough milk, he may need to be supplemented with donated breast milk or formula, or he may need further medical intervention such as glucose IV drip. The pathophysiology of a hypoglycemic baby. Neonatal hypoglycemia is defined as a plasma glucose level of less than 1.65 in the first 24 hours of life and less than 2.5 thereafter. Pathophysiology of insufficient milk supply is when an infant is not receiving enough breast milk due to various reasons that we will discuss further in this presentation. The causes of a hypoglycemic baby include there is too much insulin in the blood, the baby is not producing enough glucose, the baby's body is using more glucose than is being produced, the baby is not able to feed enough to keep glucose levels up. It is most common in babies that were born early, have a serious infection, or need oxygen right after delivery. Babies whose mothers have diabetes, babies with low thyroid hormone levels, babies who have certain rare genetic disorders, infants who have poor growth in the womb during pregnancy, and who are smaller in size than normal for their gestational age. The causes of insufficient milk supply include inadequate feeding techniques, for example, an improper latch, a medical condition such as hormonal condition, a past breast surgery, or breast problems, infrequent feeding, medication, for example, a birth control containing estrogen. Some factors that may affect the effectiveness of infant feeding include a hypoglycemic baby may be weak and have difficulty latching. Insufficient milk supply may affect an infant's willingness to latch on. Hypoglycemic babies may not be roomed in with their mothers because they need to be monitored closely or receive medical treatment. This may lead to infrequent feeding, nipple confusion, and decreased skin-to-skin contact. Some signs and symptoms of a hypoglycemic baby include hypnotonia, lethargy and apathy, poor feeding, jitteriness and seizures, congestive heart failure, cyanosis, apnea, hypothermia. Some signs and symptoms of insufficient milk supply include infant weight loss or lack of weight gain, decreased or no swallowing, hypoglycemic infants, few wet diapers. The assessment data that you want to get for a hypoglycemic infant include the glucose level, an infant's alertness and reflexes, breathing, heart rate, temperature, weight, the intake, how often and how long does the infant feed for, the output, the number of wet diapers. You want to look at how the infant latches on. Can you hear the baby swallowing when latched on? How frequent the infant is feeding. Does the baby wake itself to feed or does the mother wake the baby? Assess the signs and symptoms. You want to look at the baby's skin. Look for jaundice or cyanosis, and you want to look at the baby's mouth. Look for a cleft palate and moist mucous membrane. The assessment data for insufficient milk supply includes feeding frequency. If the feeding is infrequent, you want to ask why. Ask about expression of any milk. Do breasts feel full before feeding? Do breasts feel empty after feeding? Look at the baby's latch. Does the mother hear baby swallowing? Look at the mother's nipple condition. Previous breastfeeding experience. Assess the mother's view about breastfeeding and the mother's knowledge about breastfeeding. Assess for any medical conditions, example, is hormonal issues or past breast surgeries. And assess for any medications, specifically in estrogen birth control. The lab data that you want to look at for hypoglycemic baby include the serum or plasma glucose levels, serum insulin, and urine. You want to obtain a first voided urine dipstick for ketones, and then send the urine for organic acid analysis. What could be happening? Because of physiological reasons where insufficient milk supply is relatively low, you want to rule out the possibility of an inadequate feeding technique. By assessing the infant's feeding, you will glean the information about how the baby latches on, what the state of the mother's nipples are, if the baby is swallowing, and how the mother feels about breastfeeding. This information is all useful because it will allow you to either find the cause of inadequate milk supply, or it will give you the information you need to delve deeper and look at other causes of inadequate milk supply. These other causes may be medication, a hormonal issue, a past breast surgery, or a physiological problem with the breast. There are many reasons why this baby may be hypoglycemic, but in this case, the most common cause would be because he is not getting enough milk. Again, it is important that we review how the baby breastfeeds so that he can determine if an improper technique is the culprit. Further investigation into other causes may be needed if no problem is seen here. Some consultation that you would want to consider would be the family doctor, a lactation consultant, a pediatrician, and other nurses. My priority for this challenge would be to maintain the health and safety of the infant while encouraging breastfeeding. Treatment and nursing support. Any decisions that I made will be discussed as a team involving other nurses, pediatricians, doctors, lactation consultants, the mother, and the family. The best interests of both the baby and the mother will be considered with all decisions. Once a decision was made, support should be put into place to help the mother and baby achieve their goal of treatment. I think that this approach to care would be the best because it is involving the mother and the baby and is looking at their care from various perspectives of different healthcare professionals. It is always important to remember that even though, in general, breast is best, in some situations you have to think outside the box and develop a plan of care that is best for the individual mother and baby.